Hi everyone, Nurse Michele here again. Today I'd like to talk about some top tips on passing ACLS, Advanced Cardiac Life Support. So we know there is a lot of preparation before passing ACLS. So one of the best things you could do is study. So any materials that you can get your hands on prior to the program, for example, the textbook. Another example is on the internet, YouTube videos. Zombie notes for ACLS are very helpful. Depending on which program you're taking, whether it's a certification or recertification class, you might get a different textbook. If you're taking a certification, American Heart Association, ACLS, you'll receive a textbook. The textbook also gives you access to the American Heart Association website pre-tests. So those are very important to take pre-tests. You might take it over and over again until you feel more comfortable with the material. Remember to bring your pre-test results to the class with you. The instructor usually requires that. You have to have a really good understanding of EKGs before you come to your ACLS class. Some instructors may review EKGs, but if it's a recertification program, you're really expected to know them and how to treat them. So whether it's atrial or ventricular tachycardias or bradycardias, they're very important to know all of them. You have to also know the medications that you use for bradycardia and tachycardias and life-threatening arrhythmias. It could be the epinephrine, the atropine. It could be the amiodarone for arrhythmias. It could be one of those infusions that we use to support the heart rate and blood pressure. Dopamine, epinephrine, Levophed drips. Those are very important medications. Beta blockers, calcium channel blockers are also included in the program. Did I mention watching those YouTube videos? They're very helpful. You could check out my YouTube videos on all the topics in ACLS as well as EKGs. I'm thinking that should be very helpful to you. Practice tests we mentioned. Did you take a BCLS class, a BLS program before you took ACLS? Because in ACLS, you are required to perform your CPR skills. It might be 2 minutes or more of CPR chest compressions and using ventilatory devices like the bag mask device. Diagnoses are important also. You might need to look at cardiac arrhythmias, pulmonary diseases, patients who have sepsis, and knowing signs and symptoms. Key things that will clue you into when a patient is becoming unstable and intervene before they go into cardiac arrest. Besides being tested in arrhythmias and drug doses, we will be part of the team. You might be assigned different parts of the team. You might be the person who starts the IV, who takes care of the respiratory and ventilatory status, who uses the airway adjuncts. You will definitely be one who does compressions and applies the pads. Another very important part of that is that you might be the team leader. You will be the team leader. We will have to take turns being the team leader. That might be a little anxiety producing, but if you really feel comfortable with all this information, you can use your team to help you pass ACLS. So I'm hoping this is helpful in guiding you to pass ACLS. Keep coming on with those questions. I enjoy answering them. I enjoy reading your comments. I'll see you on the nurseeducator.com. And thank you for watching the video. Bye-bye.